Now, countries around the world are rolling out vaccination programs in an effort to stop the spread of the coronavirus. But many countries, including the US and Germany, are falling far behind projected goals. And that's making governments reconsider the way they give people the jabs.
A familiar sight from coronavirus testing. But in this Florida drive-by, people are now receiving something much more hopeful: vaccine shots. And yet the race to inoculate millions of people across the world against COVID-19 is off to a slower and messier start than expected. Insufficient supplies and complex logistics are bogging down the process. Many countries, including the US and Germany, are falling far behind projected rollout speeds. The main issue is that the BioNtech-Pfizer vaccine, the first one to be widely approved, requires cumbersome refrigeration at extreme temperatures and 2 shots within 3 weeks to be the most effective. This has sparked a debate among experts about whether the time between doses should be stretched to 3 months. Some argue that it is better to give many people some resistance to the virus than to give fewer people full protection.
The immediate urgency is for rapid and high levels of vaccine uptake. JCVI therefore recommends that delivery of the first dose of COVID-19 vaccine should be prioritized for both the Pfizer-BioNTech vaccine and the AstraZeneca vaccine.
Britain recently became the first country to authorize the vaccine developed by Oxford University and AstraZeneca. Trial data suggests it is somewhat less effective, but much easier to store and transport.
It just needs normal fridge temperature rather than the -70 super cold storage that the Pfizer vaccine requires.
Experts say it could change the situation entirely. Unlike its BioNTech-Pfizer competitor, this vaccine is more effective when the second dose is given 3 months later, leaving enough time to inoculate much of the population and endow them with partial immunity. The UK plans to vaccinate 1 million people per week from January 4th. But what may turn out to be the most promising development on the horizon is still pending approval. Johnson & Johnson's Janssen vaccine requires only 1 dose. That could simplify logistics considerably. If approved, this single-shot jab could be in use by February. The pressure is on governments to speed up vaccinations as the number of deaths linked to COVID-19 rises at an alarming rate.
And for more, I'm joined now by John Campbell, a medical teacher and author in Carlisle in Northwest England. Happy New Year to you. Thank you for joining us. The British government will start vaccination with the newly approved Oxford AstraZeneca vaccine on Monday. From the beginning, they plan to delay the second dose to get more people at least their first shot. Do you find this to be a good idea?
Yes, very much so. When they look back at the data from the clinical trials that were done on the Oxford vaccine, they found that 3 weeks after the first dose, people had 64% protection against getting an infection, which of course is great. But they also found out that no one was hospitalized 3 weeks after the first dose of the Oxford vaccine. So this is protecting against severe disease and hospitalization and subsequent death. This is the really important thing because the health service at the moment in the UK is under severe strain. It could be overwhelmed shortly. So we need to keep people out of hospital. And all the data so far is showing that 1 dose of the Oxford vaccine will do just that.
What are the risks involved in it? Because surely some people who've been promised a 2-vaccine regime who only get 1 will think, well, I'm not getting the full deal, am I?
That's right, they're not getting the full deal. But what we need to do is protect as many people as quickly as possible to prevent severe illness and people going into hospital and people dying. Now, the immunity will be boosted when people have the second dose of the Oxford vaccine. It will go up to perhaps 70 or 80%. But the key thing, the immunity will last for much longer. But because we're in a state of national emergency, it makes perfect sense to give as much coverage as possible, starting with the people that are most vulnerable and stopping them getting sick and stopping them getting hospitalized. I believe this is absolutely the right thing to do at this time.
And of course, AstraZeneca's approval in the UK is a game changer. Can we expect to see it also approved in the European Union?
Well, I really, really hope so. The European Medicines Agency, as far as we know, are not actively considering this at the moment. And I really don't understand what's going on here. There needs to be proactivity because Europe has pre-ordered 400 million doses of the Oxford AstraZeneca vaccine, and they need it desperately. I really hope this is sorted out. And in the meantime, the British government has also advertised or advocated that the Pfizer vaccine should be given as a single dose as well, because that gives 52% protection against getting the infection, and it looks like it gives 90% protection against getting severe disease and hospitalization. So I think this is something the national authorities and the international groupings need to think of really urgently, to give one dose of the Pfizer vaccine to be going on with, and then give the second dose within 3 months.
John Campbell, thank you very much there for us from Carlisle in England. And let's turn now to some of the latest developments in the coronavirus pandemic. The World Health Organization has granted emergency use to the German US-developed BioNtech-Pfizer vaccine. And this is likely to lead to more countries launching vaccination programs. In the United States, vaccinations have fallen short of the government's target for 2020, as we heard. Less than 3 million Americans got the jab instead of the planned 20 million by the end of the year. And 3/4 of England's population are now under the strictest level of pandemic restrictions. The UK has seen nearly 1,000 COVID-19 deaths for 2 days running.